start going to normally function. So with this concept, what are the unidentified questions or unanswered questions? If we balloon dilate, what are the size of these orifices? So how to address this research lacunae? ATS AP valve which was explanted, when we have seen the lateral orifice size, it was 10.19 millimeter, and central orifice size, we couldn't put the vernier caliper inside the central orifice, so we measured along with the leaflets, it was 6.49. The leaflet thickness alone 0.86, hence we can derive the central orifice of 4.77. So here is a valve which has got a 10 millimeter lateral orifice and roughly 5 millimeter central orifice. With this we did the bench test. This is a 1:1 balloon dilatation. This is a 5 millimeter balloon in the central orifice and this is a 10 millimeter balloon in the lateral orifice. We can see the corresponding fluoroscopic and video images. Absolutely there is no deformation of leaflets or fracture. We gradually increase the central orifice size balloon from 5 to 6, 7, 8, 9, 10. Up to 9 millimeter nothing happens. The leaflets bend for a moment, then it recoil back to its original shape. But when we are inflating a 10 millimeter balloon, when we are going at 12 atmosphere, we can see gradually the leaflet is coming out of that hinges and one leaflet actually dislodged. So a 5 millimeter orifice can hold up to 9 millimeter balloon, but when we go 10 millimeter, it is going to dislodge. This is a dislodged piece. In the lateral orifice 10 millimeter, we gradually increase to 12, 14, 16. So at 16 millimeter balloon, Atlas Gold, the nominal pressure of Atlas Gold is 6 atmosphere. When we are going up to 12 atmosphere, this lateral orifice leaflet is also give away. Well, this time it is not dislodged, it break into multiple pieces. So these are all the multiple pieces, but these pieces are going to happen when we oversize the balloon beyond a 1:1 orifice size. With this background, here is a clinical case of 64-year-old gentleman presenting with a stuck valve of 5-year-old valve, failed fibrinolysis at an outside hospital. Still the see here clearly the thrombus is on the left atrial side of the stuck leaflet, and this is the en-face view, and we can see the Hounsfield units was 130 units, which means it's an organized clot, hence the fibrinolysis failed in this particular case. So somebody is operating from there, that is that posterior leaflet is opening. Again I don't have the control. So this is the ECG, this is 1.17, lateral orifice is 9.25 and the central orifice is 4.16. So with this is a concept. Step 1, take a transeptal access, place a deflectable Agilis catheter. Step 2, put a protection, whatever the protection, be it sentinel or 2 carotid filters on the internal carotid arteries. Then pass a balloon, you are going to release this leaflet, and the clot material, if it goes, we are going to capture. This is a clinical case where we are taking a transeptal puncture at the inferior and the posterior part of the interatrial septum, and 2 filters are placed, and we can see in this particular image here clearly the moment the central orifice 5 millimeter balloon in place, the leaflets open. And this is the final result after opening. The normal opening angle of 85 degrees and closing angles of 30 degrees for the shape.